I, as a plastic surgeon, have a huge problem with what I call the fake plastic surgeons. Oh, have you guys seen this girl?
I haven't. She looks kind of familiar, maybe like I saw on social.
So this was like a big joke. I'm going to derail my own conversation again. So this girl is from like Iran, and she tried to make herself look like Angelina Jolie. So she started posting these pictures, but it come to find out that these were fake. These were actually makeup on her, and although she did look more like Angelina Jolie, she didn't look as bad as that, but she was doing it to get...
She looks like she was like the main character
Sarah's
from like...
a zombie movie.
Sarah's face is the most, she was like...
Yeah.
I was scared.
She looks like a zombie, right?
What she looks like, she's from those shows. What is that show?
The Walking Dead?
No,
Creep Show?
No, those movies like The Nightmare Before Christmas, like those like
like the dead people, like a zombie, right?
Yeah, she looked like somebody had like put pieces of her face from other
That's good makeup.
faces.
That's great makeup.
So when that came out, I remember seeing it, I was like, oh my, well, I'll believe anything these days because like there's weird stuff that happens, but that was actually makeup. She doesn't look as bad as that makes her out to look, but she did it on purpose to get like people on her social media.
Wow.
I think it's kind of ingeniously, devilishly smart, honestly. I'm impressed that like...
I can't get her face out of my face.
Yeah.
It does kind of put you in mind though too, of like a corpse, Angelina Jolie.
Yeah, I was like, is she dead?
If Angelina Jolie was on The Walking Dead...
Who killed this woman?
This is what she would look like. Anyway, so, all right, I'm going to re-rail our conversation. The wheels are coming back on. We're talking about fake plastic surgeons. So, what do you guys think makes me a plastic surgeon? I tell you I'm a plastic surgeon, but what makes me a plastic surgeon?
You went to medical school.
The knowledge, yeah.
I mean, a lot of people go to medical school. Are they all plastic surgeons?
And you're certified.
No. Okay, that's good. That's part of it, certification. But do you know the proper board for plastic surgery? Now, we've talked about it, but do you remember it?
Yes, but I feel like I feel like there should only be one. Are there multiple?
Yeah, there are multiple. All right, so we're going to talk about that. So let's talk about, first off, how prevalent a problem this is. So this is like one of my things, right? Because I want to police my own specialty. So when people do bad things in plastic surgery, I don't like it. And when you're not properly trained, bad things happen. So I have a problem with non-plastic surgeons doing plastic surgery. Right. So I actually did a study in the Dallas-Fort Metroplex. I say a study, it was me doing research. I pulled up every single doctor that says that they do plastic surgery procedures. Then I went and cross-referenced of whether or not they were properly trained and properly certified. So what percentage of those people do you think were not true plastic surgeons?
40.
I'll say 50.
Wow, okay, so it wasn't quite, if it was that bad, I would be, so it was about 20%.
That's still a good
that means
amount.
that 1 in 5 people in the Metroplex out there doing plastic surgery are not properly trained or certified to do it. It's crazy, right? It's hard to believe. So what defines a plastic surgeon? You kind of hit it, you were dancing around it, and I don't mean to pick on you because I'm not trying to do that, but like it's confusing.
It's fine.
It's confusing even for doctors. So the first thing is, are they properly trained? Did they do an accredited plastic surgery program? And second is, are they properly certified? They have the proper board certification? But you once again hit the nail on the head. There's different boards. So the only board that really matters is the American Board of Plastic Surgery. So why do I say that? Why do I say that that's the only proper board? Because there are 2 organizations that determine what is proper training and what is proper board certification. The proper training one is the ACGME, which is the Accreditation Council of Graduate Medical Education. I can't believe I got that out without looking at my note card. The ACGME. So they define what a proper training program is, because there's nothing that stops me as a plastic surgeon from opening up a fellowship in my office and say, I'm going to train you to do breast augmentation. But why is it not legit? Well, because it's not properly vetted. I don't have the proper didactics, meaning the book learning. I may not have the proper length of time. So I can open up my own residency, but it's not going to be accredited by the ACGME, right? So the ACGME programs is what matters. The board certification is the American Board of Medical Specialties. Right. So the ABMS. And the only one they recognize for plastic surgery is the American Board of Plastic Surgery. So why this matters is, like, if you as a plastic surgeon want to go get credentialed at a hospital or like a surgery center, they are responsible for making sure that you're properly trained. So they make sure that you went to an ACGME program and they make sure that you went to an American board, or that your board certification is ABMS, all right? Otherwise, you cannot get privileges. I cannot go to a hospital and do a heart transplant. Why? Because I wouldn't have that proper ACGME and ABMS certification, okay? So how did these fake plastic surgeons do it, you might ask? They do it in their offices, because there is nothing whatsoever stopping me from having a patient come to my office and I say, I can do this procedure, and if you sign a consent form that you allow me to do that procedure, then there's nothing illegal about that. And even though I may not be properly trained to do it, I can do it because you signed a consent and I'm a doctor, and the laws are very loose. Now, there are things about being, having your medical board license, and if you do something really crazy, like say I, in my office, tried to do a heart transplant, which obviously I would never do. Like that is so far out of the scope of like what I'm doing that I would lose my medical license in the state of Texas. But the gray area is when people are doing things, they're like, oh, well, I can do a breast augmentation because I did a weekend course with Dr. So-and-so in Los Angeles. And so the Texas Medical Board might look at that and be like, okay, well, maybe this isn't, the proper way to do it, but we're not gonna like shut them down. And so that's how these fake plastic surgeons do it. Now the problem as a person in the community, how do you tell who's real? Because these people will have great websites. Like you go to their website and they'll say, I'm board certified, and you're like, okay, that's important, but they don't mention that their board certification is, the American Board of Cosmetic Surgery, which is not legitimate, or maybe their board certification is the American Board of General Surgery. Like they're just general surgery trained, but they're doing plastic surgery. So if you're gonna go have plastic surgery, you need to make sure that your person went to a proper program and really has a proper board certification. And you can kind of just go to the proper board certification because you cannot be boarded by the American Board of Plastic Surgery unless you went to a proper training program. And so that's why it just boils down to the board certification.
Yeah, now I wanna like go back to my doctor and see if he had one.
It's crazy.
I got mine done so long ago, and I got my breast implants in house. Like I didn't go to a doctor. Like I didn't go to a hospital. Look 'em up.
One of my favorite games to play is
But it was in a medical. Like it was like he had his office inside a medical facility.
That doesn't matter if it's
like
not in
attached to a hospital.
So like surgery centers are accredited. They're called Quad A certification, and that ensures that they are going to properly vet people. Yeah. I do that at the surgery center I work at. I'm on the board that vets people.
Yeah, I definitely had mine.
Well, look, one of my favorite games to play is I do a lot of revisionary surgery.
I'm alive though.
I'm glad you're alive. One of my favorite games to play is when people have bad botched plastic surgery. I always go and look them up and see if they're really a plastic surgeon.
Now I need to.
Also, you need to be wary of anyone who calls himself a cosmetic surgeon. Like I would never call myself a cosmetic surgeon. I'm a plastic surgeon. I do cosmetic surgeries, which just means a surgery that's done to make your appearance better. But I am not a cosmetic surgeon because that is not a real term. Anyone who calls himself a cosmetic surgeon is probably one of these fake plastic surgeons.
Yikes.
That's a good game. No, that's definitely good game, something to look out for.
I mean, this is stuff that's so, when you ask even a doctor, like, what's the proper board certification for plastics? Most doctors don't know it. So if a doctor doesn't know it, how is a patient going to know it?
Right.
How are they going to know? Because they watch Nip Talk. And we're telling them what you need to know.
I'm going to be telling people.
You tell people. Yeah. Spread the word.
Sarah's
it is a problem.
Advocate.
This is kind of like one of my soapbox things, It's like, I hate when people do the surgeries that I spent 8 years of surgery training to do because they went and did a weekend course. I mean, it's just wrong.
Right.
Well, it's like disrespectful.
It is. Don't disrespect the doctor.
Don't. What's that thing from South Park?
Don't respect my authority. All right, derailed again.